Today's topic, COVID-19 in children, what to know about pediatric multi-system inflammatory system, signs and symptoms. What should parents know? Tonight, it's my pleasure to introduce our presenter, Dr. Lightman. Dr. Lightman is a senior statesman among pediatricians, an internationally recognized authority, a public speaker, expert witness, and go-to resource for health issues in the Jewish community. He's part of our JCC family and nursery school and even serves on our drug-free community coalition, 5 Towns Saving Lives. Originally from South Africa, Dr. Lightman earned a bachelor's degree in medicine from the University of Witwatersrand and a diploma in children's health. He even served for 2 years as a physician in the South African Army. Dr. Lightman came to the United States, pursued a fellowship in asthma and immunology from Long Island Jewish Medicine. He started his own practice, Total Family Care, in the 5 Towns in Far Rockaway, and teaches at Hofstra and other local universities. Dr. Lightman, it is truly our pleasure to have you speak this evening. Tell myself and the audience, what should parents know about this frightening syndrome?
Okay, thank you very much for the opportunity to explain what is going on. I just want to reiterate that we're dealing with something that is changing daily, if not hourly. So what I might say tonight can be completely different tomorrow. It is this coronavirus, COVID-19 disease is such a moving target that it's hard to even pinpoint what's going on. The advantage was, until now, we said, okay, children are safe, they do not spread the disease, they don't catch the disease, and we could breathe a sigh of relief. It was just the older individuals, it was adults, and everybody felt, well, that's great for children. However, things have changed drastically. So we talk about something that has multiple names. They call it PAMIS, Pediatric Multi-System Inflammatory Disease, or they changed the name to Multi-Inflammatory Syndrome in Children, MIC-S. And what does it mean? It's affecting organs and blood vessels. So if we look at all the cases, about children, about 1.7% of all the COVID cases in the United States. And not all the children with the syndrome have had COVID-19, but the point that's interesting, they've been testing positive for the antibodies. So even though people were unaware that their children had the disease, they didn't even check them for their nasal smear, all of a sudden, 6 weeks later, they're coming down with this rare condition. And I want to repeat, it is rare. It is nothing that we have to go crazy about and Google and panic. It is rare. And it does give us a certain amount of time to look for it. So you say, well, if a kid shouldn't go to camp, and then they're going to go to camp because we'll close camps because they all might get this particular disease, that's not necessarily true because it occurs later after having had the disease and having had a nasal, picks up the condition, but then the antibodies then are causing a problem. So I want to just share information and say that please do not Google. Don't try and acquire information from anybody else, especially parents, relatives, and friends, because we're all going to have misinformation and things are changing. Now, COVID-19 is this moving target. And what we knew on March 15th, and then April 15th, and then May 15th is changing. Hopefully by June 15th, we'll know even more. And eventually we'll be able to look back and say, well, this is how we handle it, and this is what we've got to look for. What's important is to say that even though COVID-19 is a respiratory problem, and especially in the adults, it affects the lungs and such, even though it can affect multi-organs and they can go into many multi-organ failure, it even has neurological complications. In the children, it is not necessarily a respiratory disease, but it's mainly affecting the organs. And what happens is the blood vessels tend to get inflamed. So they see that in the adults, when they go into the crisis, it's something called cytokines. When we have an immune response, the body releases certain chemicals to fight this immunity. They see what is abnormal, and then it attacks the abnormal cell. However, if they go into this overload of cytokines, it actually attacks normal tissue as well. This is what they believe might be happening in the children, but at a later stage, not early as in the adults. So what do we have to know? That it's similar to something that is called Kawasaki disease or toxic shock syndrome. Now, Kawasaki disease was discovered by a Japanese physician in the 60s. And this was a disease originally thought it was in Japan, and then they found it was universal. And they weren't sure what was the cause. There were many theories. Oh, in Japan, it was due to carpet cleaners, etc. And what it is a disease where a child has a high fever for a long period of time, at least 5 to 7 days. And then they can develop a rash. They get a conjunctivitis, but it's not a typical conjunctivitis where there's pustule pouring out of the eyes, but it's more red lines across the white part of the eye. Then they can have a big swelling in the neck where the lymph nodes are enlarged. Then they get a skin rash, all different types of rashes. Sometimes they find peeling of the hands and the feet, even in the genitalia. There's a puffiness of the hands and the feet. And that's usually what we see in Kawasaki, or they might have a little bit of abdominal pain. However, in this condition, not necessarily all these things present, especially the bloodshot eyes, even the skin rashes are not always there. However, they do sometimes find in these kids having abdominal pain. So they have severe abdominal pain and diarrhea. Now, many kids get diarrhea, so we can't say, well, the kids got diarrhea and we start panicking. But in these cases, they can have diarrhea, they can have abdominal pain, even a very fast heart rate, where the heart is racing. They might even complain, if they're old enough, that there's a symptom of chest tightness and chest pain. And all these things can overlap with the myriad of diagnoses, so that makes it also difficult. But what do we have to look for? If the child is having a persistently high fever, they're having abdominal pain, they just seem to be out of it. They might have the rash, they might have the red eyes, and the peeling of the skin. But if they're complaining of anything of these things, you must take it to your physician. They must think about this. Unfortunately, it's a disease that we say, well, do we think, unless you're thinking about it, you tend to miss it. Because it's a disease that's rare, but it does cause inflammation of all the different blood vessels. And if it's left undiagnosed, it can damage the heart. Because Kawasaki, for example, would affect the coronary arteries. And then these are the blood vessels that give blood to the heart and oxygen to the heart. So if these blood vessels get enlarged, then they get an aneurysm, and this can cause long-term problems. So that's Kawasaki. So this has similar effect, except it's not just the heart that it gets affected, but many organs. So they get inflammation of the blood vessels that go to multi-organs. The problem is, in the beginning, they thought, okay, mainly this is in kids between 5 and 14 years of age. But no one really looked at anybody older than that, because it doesn't come into one's mind to think, okay, maybe a 14, 15, 18-year-old can really have a Kawasaki, or let's call it the multi-system inflammatory disease syndrome. Can they have that? And if you're not aware of it, you're not really looking for it in the older individuals. So what's the problem is you have to realize it is not infectious. It is not, it's a post-infectious disease. It is not contagious. It cannot spread it from one person to the other. It's after they've had the infection. And what's happened is that because they don't have respiratory problems, people are not aware of it. They're not thinking about it. So if the child has a fever, or they have a persistent vomiting, abdominal pain, bad diarrhea, a rash, anything that makes you suspicious, don't be shy. You call your physician, you point it out to them. They're well aware of this disease. Everybody's relatively well educated now, and they look for it. There are many tests that should be done. A lot of these are done in the hospital, in the emergency room. If they think it's necessary, they will admit the child. And it's not just the regular test that they're looking for, the blood count to see if there's any inflammation, but they're looking for what inflammatory markers that you normally see if people even had a heart attack. So they're going to be measuring these type of things, because even in the adults, I'm not sure if a lot of people were having heart attacks, were not really heart attacks, but it was these inflammatory markers that were coming from the COVID virus. So what I want to say is, thank God it is very rare. It's not, shouldn't be the first thing that comes to mind when any kid's unwell, but we have to take a deep breath and realize that we're not in control of anything in this world. It's all up to God. And if we work together and we think that hopefully this horrible situation will pass soon, we'll have the armamentarium to attack it in the future. We still practice social distancing. Everybody should be wearing a mask out of doors. I think we still shouldn't be exposing the elderly or grandparents, etc., because all the holidays that are coming up, everybody wants to get together, but we've got to use our intelligence and say, look, it's not that we're protecting ourselves, but we're protecting our beloved relatives, etc. And if we do that, And hopefully, I really hope that camps can open this summer because the kids need it, the parents need it, society needs it, and everybody wants to go back to normal life. If there are any questions, please don't be shy.
So Dr. Lightman, a question came in. What are your thoughts about antibody testing for children, for kids?
Okay, antibody testing is very controversial because really, what does it show us and what are we going to do with it? So there are different tests that are available. A lot of people are bringing in tests from China to test on a finger stick. Finger stick test at this stage is not really FDA recognized. There is one coming out possibly in a month or two, and that will tell us if a person's had antibodies. There's a new test that's coming out from Israel with through a breathalyzer, and it gives an instantaneous test through breathing if the person has active coronavirus at that particular time, which is respiratory or from the nose. However, what does it mean if we have antibodies? So there's two types of antibodies. One is called IgM. When there's an acute infection, we mount a response called IgM. Over time, we develop antibodies called IgG. These theoretically, in most cases, are long-term, they're there for life, and depending on the level, they provide a certain amount of immunity. So when we vaccinate children, for example, we are there giving them a vaccine that is to stimulate IgG. And this IgG then stays in the system and gives them immunity. Sometimes it gets a little bit lower, and that's when we give a booster vaccine to re-enhance and to increase the IgG level. However, when it comes to this COVID virus, what does it mean? So yes, there are people who had the nasal swab was positive. They were sick as a dog. They had respiratory problems. They went to be tested for antibodies, and lo and behold, there was no IgG. There were other people who had no symptoms. They didn't even have a headache. They had no fever, and they've got IgG antibodies. The question then arises, what does this mean? So certain places like the Mayo Clinic, Mount Sinai, were trying to measure the antibody level and saying if it was a high enough level, that should give them immunity, and we hope that it would continue. There were some people then who had antibodies in the beginning, and then after 2 months, the antibodies disappeared. So it is something that is in development, and we really don't know what to say. So the advantage is saying, okay, if I've got antibodies, hopefully they'll last, at least I feel emotionally comfortable and protected, say, well, I've got some type of protection and I know I had the disease. The only thing is we don't know how long they will last for. If it's like other diseases, etc., it should be relatively long period. Maybe it'll be 2 months, maybe it'll be a year, maybe it'll be 2 years. That is only something we can do in retrospect and look back in a year's time and say what level of antibody was significant and how long did it last for. So I think by testing for the antibodies, it gives one a certain sense of comfort, but is it realistic comfort or not? But that's the bandwagon that everybody wants to get on board and say, well, let me go test for antibodies, or let me test people for antibodies. So hopefully it means that you've got antibodies, will have some protection, but we don't know.
Okay, Dr. Lightman, regarding testing, another question. When you were tested, when adults are tested, how long does that last for? Could they test positive one day and the next day contract the disease?
Okay, you're talking about antibodies or the nose?
The nose.
Okay, so the nasal swab, which feels like a swab is coming out the top of one's brain, it all depends on how it's done, who did they do it correctly, was it a complete test or not? Because unfortunately, if it's just a prefunctional one that goes a little bit into the nostrils and it's not getting enough of the viral particles, it can be a false negative. So there are people who are negative, become positive, and then they rechecked, they're negative, and lo and behold, they become positive again. There are people who've had nasal swabs who are positive for 35 days before they become negative. So the argument is the material that they're testing that's positive after a long period of time, saying the person is a chronic carrier, are they really shedding the virus, or is it dead RNA material that's still in the nose? So if it's dead RNA material, then really, theoretically, they're not shedding the virus, but they're coming out with a positive nasal swab. So if they're in the healthcare profession, or they work in nursing homes, etc., then you really don't want them to still have a positive nasal smear. So again, there's controversy. Is it really positive? Is it a false negative? Is it a false positive? And only time will really tell. But I'd say that if a person has a nose swab and antibodies, then possibly that the nose swab is just residual material and antibodies are more significant. So the nursing homes are now being required to test everybody with nasal smears at least twice a week and to test them for antibodies, which is very costly. Time is really a problem with this, and you have to bring extra people into the nursing homes and to test all the workers, etc. So I think it's something, as usual, with COVID-19, who knows?
Wow. Okay. Now, Dr. Lightman, why aren't we seeing adults with symptoms of multisystem inflammatory syndrome?
Okay, so there have been certain cases where they report in the literature, 1 or 2 cases they thought might have had it with a multi-organ failure. It seems that the kids are having a delayed response because their immune system is getting enhanced later on, whereas the adult is an immediate crisis where all the organs are being attacked in the beginning. So that's why they haven't really seen it in the adults, but I don't know if everybody was completely aware of what was going on, so they didn't look for it in the adults. They are finding in adults, for example, a lot of vascular problems, meaning that there's a lot of clots. So you never would have expected the disease to cause clotting in not only arteries, but in veins. So you're having people having strokes, people having clots in their lungs, multiple little clots. They're getting DVTs, clots in their legs. So that also could be part of an inflammatory response which is affecting the blood vessels. So I think a lot of this is still to be determined, but if they're aware of it, they will look for these things in the adults.
Dr. Lightman, do you anticipate giving out vaccines to your patients in the near future?
If it's available and it's efficacious and it's been tested and it's safe, then I definitely would like to do that to help prevent any upsurge in this nasty virus.
I think you addressed this question, but do children, can they be contagious? Can they carry this syndrome to adults?
No, this is not a contagious syndrome. They've already had the virus, and now weeks later they're having an immune response to it, but they're not, it is not, this particular multi-inflammatory syndrome is not contagious. You cannot pass it from one person to the other.
Okay. So, any other questions from the audience? You could type into the chat room. Are you seeing many cases in your practice?
No, thank God not. I mean, we look for it and we send them to the hospital, but at the moment, we've been fortunate enough to say that no one has tested positive for it yet. I mean, they're talking about the multi-inflammatory syndrome.
Yes. Great. So, okay, I think we covered the questions. So one more, everyone's asking, what about the future? What activities?
Okay, I wish I was a prophet. Would I like camps to open? Definitely. Would I like everybody to be healthy and safe? Definitely. Would I like this thing to go away? Definitely. Will it? I don't know. But I think there's so much new developments occurring worldwide, and especially from Israel and other countries, and hopefully in America too, regarding a vaccine, regarding testing. I think it's vitally important that if there were enough tests, that every single person should be tested. For example, if you wanted to open up a camp, especially a sleepaway camp, where you would have a contained unit, would be like in a bubble, and it's possible if you tested every kid, if they had a rapid test, if you had a test, for example, like you have a rapid strep, and you could test everybody and take the temperature before they board the bus, and if they their nasal culture was negative, and let's say they had antibodies, then you say, okay, we've got a chance of these kids going to camp, or we can isolate people if they turn out positive. But there's so many new developments that have to come into the forefront that hopefully these will be by September, because unfortunately, as we go into the colder months and winter starts approaching and fall, we do not want an upsurge, because if you look at the Spanish flu of 1918, you had the same peak that we have now, and then unfortunately, there was a massive, massive upsurge in the following fall to winter when millions and millions, up to 20 to 50 million people died worldwide. And hopefully we will not have that, but we do have medication, we have medicine to try. There are new developments occurring with different antivirals. It's in fact one coming out, that trial that just discovered in Israel, that medication against Gaucher's disease can be efficacious against the COVID virus. So there's a lot of new developments coming out, and hopefully we'll all be around to see them, and it should be quick and we can get on with life.
Thank you. A few more questions came in. Are infants or even children with special needs more susceptible?
Okay, that's also in information. We know that obviously a kid with special needs is being exposed to more people. So it depends what their special needs are. If they have respiratory problems, if they have a tracheostomy, if they have asthma, they have, let's say, an IgA deficiency, which predisposes them to any upper respiratory tract and pneumonias, etc. And of course, they're definitely at more risk. Also, a child, or especially in infants, the immune system is not that fully developed. So theoretically, they could, if they're getting some protection from the mother. There are cases where you have the mother who is COVID positive, gives birth, and the baby seems to be fine. So there's a lot of things that we have to see. We don't know, for example, what happens early in a pregnancy if a mother gets it, and then in 9 months' time, we'll see what happens to that baby. So unfortunately, there's a lot of things that are developing, but most children, most babies seem to be safe at the moment, other than this disease.
To that note, we have a concerned parent whose son has a cardiac issue, tetralogy of Fallot.
Right.
Does that put him at higher risk?
Okay, so we regard everybody with a chronic cardiac condition, a chronic lung condition, somebody who's on, let's say, they have Crohn's disease and they're on a immune suppressant, anything like that, we put them into a category of a higher risk. Doesn't mean they're coming down with it more than anybody else, not really, but we regard them as high risk. We want to have more precautions. Anybody around them should be wearing a mask. Anybody that is coming into the house, I always tell them, it's when you wear gloves, it's not gloves that you bring into the house. You should be wearing gloves when you go out, but you must discard them before you come back into the house, opening your car door or using your car clicker, because you can be transferring it. Wearing gloves doesn't make you safe. Hopefully it prevents you from touching your face, because we touch our face at least 26 times a minute, and that's how we can spread the virus. So wearing a mask in public, wearing gloves, going out, shopping, etc. is important. And I think it's important to realize when you come home from these places, take off your shoes and leave them inside the front door, because it can also carry it that way. Now there's also, what's the controversy? Well, does it stay on plastic? Does it stay in metal? At one stage you'll say, yes, it's staying for 4 hours, 9 hours. Now they're arguing, or maybe it doesn't stay on the plastic or the metal. So to be cautious, if you're getting deliveries, it's not going to be on the food, but just wipe down the external surface of the box. And I think that's what you should do. Anybody who's got a chronic condition, don't risk it by going shopping. Rather get a surrogate to do it for you. But it doesn't stop anybody going outside, getting fresh air, walking socially distant. It means we can still communicate with each other. It doesn't mean that we have to be distant from each other in an emotional way, but socially distant and using one's intelligence.
Thank you, Dr. Lightman. Your words, if camp will open this summer, what are your thoughts and concerns? What should we be doing?
Okay, if camps don't open, then I think child abuse, domestic violence, and alcohol abuse is going to increase. And already, unfortunately, some of the studies have shown that there is an increase in that, because it's very, very difficult. The parents have an extremely difficult job. What is the most open door in the house today is the refrigerator. I suppose that's why we should call it COVID-19, because the average weight gain is 19 pounds. But the point is, children are meant to be free. They've got to experience relationship with other children. They've got to have ability to interact. And when we lock them up and we keep them confined, all it is doing is increasing their anxiety as well. So there has to be, by at least people who are far more intelligent than I am and have access to better data, that how do we open the camps? Can we do it in a confined way, just like we did at the time of the swine flu? Maybe if it's instead of having 2 trips, you have one long trip where it's a self-contained unit, no visitors, no visiting day, all deliveries are dropped at the gate, and the kids themselves with the staff will have to be the cleaners, the cooks, and if you feed in the beginning everybody at their own bunkhouse and then you slowly integrate them, then possibly that would work. But everyone would have to have their temperature taken before they board the bus, when they disembark, and daily temperatures taken at camp, and maybe something will work out there.
Thank you. At what point can we feel comfortable to get together with family in small groups?
Question mark. I don't know. I'd say we slowly get, look, even though we're meant to have social distancing, that's gone. I mean, people are fed up, they're frustrated, they're exhausted, the weather's good. Many people are not social distancing, they're going to the beaches, they're going for long walks and all the different parks, etc. So we can say, if you look at certain states, they've opened up everything. Other states are still in lockdown. So it's up to the authorities with the correct medical advice from the people that have the know to start opening things slowly. And if we practice social distancing and we use our intelligence and not just let our guard down, I think things will improve. But we've got to worry about an upsurge, and there might be a slight one in the beginning, and hopefully it will taper off, but we've got to watch out for the fall.
Thank you. Dr. Lightman, how does plasma help people with COVID? And do you recommend people to donate the plasma?
Okay, so some of the studies have shown that definitely the plasma works. What the plasma is, they take the blood, they spin it down, and they separate the liquid, the serum, from the blood cells. And in the serum is where you find the antibodies. So if the antibody levels are high enough and they inject that into the sick individual, that hopefully enhances their immune system, the ability to fight. And the person who donated it then gets back the red blood cells that they gave, so they shouldn't become anemic, as well as some saline solution back into their own system to keep them going. So a lot of the studies have shown, yes, this plasma infusion is helping. Is it the perfect cure? We don't know, but there are a lot of new antivirals that are coming out and new medications that seem to be helping.
Great. Okay. So I think we addressed one last question. Let's see. I'm seeing a lot of kids playing outside together over the last week or two. Do you say it's safe to go outside, or would you still say avoid it for a little while longer?
Okay, you don't want to lock anybody up. You can't lock your children up. They need fresh air, they need vitamin D. There's going to be a lot of vitamin D deficiency because they're not getting exposed to sunshine. They're losing out on social integration and social cues. So can they play together? Well, that's another problem, because let's say they go bike riding. Fine, so by bicycle riding, there's already a certain amount of social distancing. Should they have a mask with them? Definitely. Should they wear it when riding the bicycle? That's a problem because it's hard to breathe and you don't want them to develop too much carbon monoxide, which is a problem. So anybody's driving a car, for example, you should have your mask with you around your neck, but don't wear it when you're driving a car because it can affect the breathing and there could have been car accidents as a result. So children should go outdoors. Now, who they're going to play with? So I say if they're going to play with neighbors, it should be at a distance. If they're playing ball, for example, then they should wear a mask if they get close, or they should wear gloves, because when they throw the ball from one person to the other, you don't want to really spread it. And when they come into the house, take off the gloves, take off their shoes. But we've got to start letting the kids interact, but in a intelligent, appropriate manner, and where we have a little bit of social distancing and not that everybody's getting in and out of another person's house. Play outdoors where there's fresh air and there's more room to have social distancing.
Along those lines, do you agree that pools should be closed?
Okay, that's also a question. Now, we know that it's not really spread in pools, so there's enough chlorine, etc. But if you have many, many people all jumping into the pool at the same time, they're mixing, they're playing together. So let's say, okay, you want to have a public pool. If it's a private pool, you have one family swimming at a time. If you have a public pool, you're going to get lots and lots of people coming. So unless they can control the pool, if they're controlling a supermarket, that X amount of people can come in at a certain time, and I don't think you can swim with a mask, but they say they go in the pool and they're not playing with each other, but they're having a splash in the pool, cooling down, etc. Maybe that can be done because pools do have a natural chlorine. They've got chlorine in and all these different disinfectants, but you can't have masses coming into the pool and swimming at the same time.
Okay, great. So, Dr. Lightman, thank you so much for sharing this evening. It was very informative, and on behalf of the Growl JCC, thank you for all you do for the community at large. Be well.
Let's hope that everybody stays healthy and well, and new developments come, and it's to the benefit of everybody.
Great, good. Thank you. Have a good evening.
You too, and to everybody.
Bye.